Good evening, everyone. Hi, I'm Dr. Mythily Sindhur. I am attached to BabyChakra Children's Clinic and Surya Hospitals, Mumbai. Thank you, BabyChakra, for giving me this opportunity to talk on a very important issue, which is being considered to be a global health issue nowadays, which is monkeypox. So today, I'm going to answer your questions regarding monkeypox. Whatever doubts you have, you can post it. Okay, so coming to the brief introduction about the monkeypox, it's a virus basically belonging to the same family of smallpox and chickenpox. So these are like belonging to the Poxviridae family. They come under the genus orthopox viruses. Monkeypox was first discovered in monkeys in 1958. The history goes back to 1958, where it was found for the first time in monkeys. That is why it is named as monkeypox. 1970, it was discovered in humans. It is now considered endemic in West Africa and Central Africa regions, as it is most commonly seen over there. But in 2003, there was a first outbreak in US other than African countries. And later, 2022 is saying now it is almost present in 83 countries. 23,000 cases were diagnosed in almost globally. So how to detect this monkeypox? Because it is very commonly seen, fever, rash symptoms. You see commonly in chickenpox also, and even in hand, foot, mouth disease. So how to differentiate that? The first initial symptoms will be the same as viral fever, like with fever, headache, body aches, and some respiratory symptoms like coryza and cough. And later on, from first to 3 days, you see rash erupting up. So initial days, the rash will be like pink, small dots, and after that, it will erupt into fluid-filled vesicles. You will see like a size of a mustard with the fluid inside it. And later on, it increases in size, and then it dries up after 2 weeks and forms a scab, and then it heals. So the total healing time is 2 to 4 weeks. Even though this monkeypox is self-limiting disease, the symptoms are painful and there is a high chance of transmission from human to human. That is why this is a concern now. Now, coming to how to prevent the human to human transmission. Parents, please don't panic that it might spread in schools. It's basically transmitted from human to human with the touch of the skin lesions, or when you come in contact with the clothes used by the infected person, or when you come in contact with the body fluids of the infected person. And animal to human transmission is also possible when you touch any dead rodents. So it is mainly considered to be transmitted through rodents and monkeys and apes. So whenever you come across any dead animal, please don't touch it. Or whenever you are you have pets at home, be careful. Mainly the prevention is through isolation. Use different clothes and different utensils for the infected person. And whenever the caregiver who is taking care of the infected person at home should wear a PPE, gloves, and as soon as you dispose the clothes used, and or if you are cleaning the utensils used by the infected person, make sure you wear gloves. And after that, wash your hands properly with soap and water or alcohol-based hand rub. So hand hygiene is important. PPE is important whenever you are coming in contact with the infected person. And main thing is don't use the same clothes or linen, bed sheets or towels. Make sure that you are using it different. Okay. Coming to the treatment, there is a lot of research going on the treatment for mainly hospitalized patients. Antiviral drugs, there is a lot of research going on for antiviral drugs. For home manageable patients, it is all supportive treatment. So nothing to panic or get anxious. So for the skin lesions, you need to apply any topical Caladryl lotion if the kid is having any itching. And if the kid is having fever, give paracetamol. And when the lesions are fluid filled and when it is painful, just you can manage it with analgesics. And if the genital regions have ulcers, so it is advisable to give sitz bath. And whenever the lesions dry up, even the lesions dry up, the person is considered to be still infective. So please make sure that you have strict isolation for 2 to 4 weeks. The incubation period is very long. So it is 5 to 21 days. So whenever there is a travel from the African countries, so if any fever with unexplained rash, then you need to observe for 21 days. Because of the longer incubation period and longer infective period, that is why it is getting underdiagnosed. The monkeypox is getting underdiagnosed, and it is very similar to other vesicular lesions. The rash in monkeypox is very similar to rash in other vesicular lesions, like where you see in chicken pox, which you see in hand, foot, mouth disease. So healthcare professionals and parents should keep a high index of suspicion whenever you see a patient with fever and rash. The other differentiating feature between the monkeypox and the other pox viruses is swollen lymph nodes. The swollen lymph nodes may be seen in the neck region, around the ear, or in the underarms, axillary regions. Coming to the how to manage the skin lesions, painful skin lesions when a kid is suffering from the rash and all. Do not panic or do not be anxious. So you can clean the lesions with a common antiseptic lotion, and then you can apply mupirocin ointment when it is in the stage of the vesiculopapular rash. After it is dried off, then you can apply calamine lotion. Now coming to question and answer session. Any more questions? I think this is interactive session. I want you people to ask whatever doubts you have. I'm here to remove any fears. What home care is needed along with the medication? So coming to home care, main is strict isolation, and do not touch the rash, and do not scratch the rash. Okay, because the fluid, when it is touching the other parts, there is a high chance of spreading. And whenever you are using the clothes, whenever you are handling the clothes and linen of the infected person, make sure you are washing your hands soon after doing that. And don't shake the linen. We as Indians have habit of, after washing, drying off, shaking the linen and all. It might spread the infection. And use PPE. It may, even though it's not proven, droplet through respiratory secretions and all when you have symptoms like coryza and all. So make sure that you wear mask and take care of the infected person. The second question. So the government has yet to decide on lockdown. We have right now confirmed cases, 9 cases, 4 from Delhi and 5 from Kerala. So if it is like spreading and if it is, the situation is becoming worse, then lockdown may happen. How can I manage the discomfort caused by the rash? By wearing loose cotton cloths so that it's not attached to the rashes when the rashes are burst and when the vesical fluid is coming out. And you can apply topical mupirocin ointment for the healing. And you can use Caladryl lotion once after the rash is healed, or if you feel itchy, you can use antihistamine syrups like Sedzin and all can help. You can use simple analgesic when it is in the painful, when you have vesiculopapular rash. The rash stages, there are 6 stages of the rash in monkeypox. So first it is like red rash and then comes into the pink raised lesions, and after which it forms fluid filled vesicles, and later on it crusts and scab forms. So when it is crusting and all, then you can use Dermocalm lotion or Caladryl lotion for soothing of the skin. Next question. How can I prevent monkeypox infection? So mainly to keep a high index suspicion. So whenever you come in contact with a person having suspicious symptoms or with a history of travel from endemic countries, and right now we have cases rising in US, and last week there was a high rise in US and UK. Right now they are, US is at the top in endemicity, in the epidemiological situation of monkeypox. So when you come in contact with any suspicious person, observe for 21 days at least if you are developing any symptoms, and then get tested for PCR only if you feel that there is a high chance of monkeypox. And preventive measures is like you need to whenever there is a rash, please don't touch the other surfaces, and all should be disinfected. Wherever the patient is present, the room should be cleaned and disinfected properly, and whenever if the hospitalization is needed for the patient, make sure that the hospital personnel know that you will be coming, and ambulance is provided with the proper facilities and all. And disinfection should happen before and after. How long it will take to recover from monkeypox? It takes 2 to 4 weeks. The rash may start disappearing after 2 weeks, but the total scab formation and to completely heal, it may take 2 to 4 weeks. Any other questions? So takeaway message about monkeypox. So we know only tip of the iceberg regarding monkeypox. There is a lot of research going on for the medication, for the treatment of monkeypox in children, for the vaccines available. It was thought that smallpox vaccines work, but whether they are effective in children or not, the research is still going on. Until then, until the government and healthcare providers come up with the proper guidelines for the treatment and immunization against the monkeypox, we should keep a high index of suspicion whenever we come across with the person with fever and rash and swollen lymph nodes. And observe over a period of 21 days. And if at all any symptoms occur, inform the healthcare professionals immediately. Home manageable cases can be treated at home itself with a strict isolation and proper disinfection of the clothes and utensils, and using of PPE and maintaining hand hygiene. These things can prevent spread to others. I hope I have cleared all your questions about monkeypox. It was a wonderful session. Thank you, BabyChakra, for giving me this opportunity. Signing off.